We begin with a crisis in our country that is affecting families here at home. Even in 2023, with all the advancements in medicine, mothers are still dying after childbirth. Much of this has to do with access to care or lack thereof. Nearly 7 million women in the U.S. have little to no access to maternity care. That's according to a new report from the March of Dimes. 4.7 million live in what researchers call maternity care deserts, counties without places like hospitals or birthing centers offering obstetric care. And that lack of access is critical. It can mean the difference between life or death for both the mother and child.
We know that many women don't have access to the preventive and emergency care that they need during pregnancy and after pregnancy. And part of that is that many women don't have the extended coverage that they need for postpartum care.
We're seeing this access issue here at home, depending on where you live, though. While it's easier to get help and care in our more urban counties across the metro, which are in green here, some of our more rural counties in red are considered care deserts. Then there are complications to consider. Issues can last for months, which is why the state of Missouri expanded Medicaid coverage for mothers to a year after childbirth, and it prompted the state to track women for the same amount of time. The state report released just this month found every year an average of 70 Missouri women die while pregnant or within 1 year of pregnancy. So what's causing these deaths? Mental health conditions like postpartum depression and substance use disorders are now at the top of the list, followed by cardiovascular disease, then homicides. These are problems state experts say need to be addressed.
No disrespect to any other members of the family unit, but the mom is the glue. She's the center. And you take that mom away and it will have lifelong, and it will also have cross-generational impact on that family.
Researchers also found a major racial disparity. Black women in Missouri are 3 times more likely to die within a year of pregnancy than white women. This is a national issue felt here at home by women in both our states. So joining us now to break this down, please welcome Drs. Tracy Johnson and Tiffany Ruffin with University Health. Thank you both for being here. Dr. Johnson, you are an OB. You are chair-elect of this group that is monitoring these mortality statistics, this review board. Are these numbers surprising to you?
They're not, and they haven't budged in quite some time, actually. They've been that way probably since 2014-15.
What does that tell you?
It tells us that we're not doing enough, and we are a little bit delayed in the data, but we've got to do way more.
What do we need to do? What are the actionable steps that we need to take here?
So interestingly enough, the primary cause maybe 3 years ago was actually cardiovascular diseases, and that's been surpassed by mental health disorders, which includes not just substance use disorders, but suicide, which is pretty new on the scene. We've always had deaths by suicide, but that has increased drastically in the last couple of years. Number 2 is now cardiovascular diseases, which is a large basket of different conditions. And 3rd is now homicide, which was not really a problem as much as it is 3-4 years ago.
Really? And we talk about psychological stress. I have to imagine the pandemic plays a role here.
Mm-hmm. Absolutely, yes. And so we know that with looking at things that are protective for people, and so when we want to talk about not just the risk factors, but what offer people protection from these outcomes, one of the things is that social support. And when we look at the pandemic, there wasn't that kind of social support. People were living in more isolation. There were even more barriers to getting care. People were scared to go to their doctor's appointments. There was a very real anxiety about going to the doctor's appointments, to getting the care that they needed. And so we saw even more increased numbers of these perinatal mood and anxiety disorders.
You know, you're a psychologist specializing in maternal mental health. Has the pandemic, some of those problems, has that subsided at all? Now that we're kind of getting out of it a little bit?
I don't know if it's fair to say it's subsided. I think now we're seeing different ripple effects of it. And so people are still struggling with that rippling anxiety of, is it safe to take my baby out? Is it safe to do this? Is it safe to do that? I didn't leave my house for this long. Or folks who had babies during this time are saying, my baby hasn't been socialized at all for very good reasons. And now I'm so constantly worried about my baby being okay. And so we're seeing a different level of anxiety, of depression, of social disconnect.
How do you address that before it's too late?
Talking about it, I think, is one of the most important things, is having these conversations to know what to look for if you know someone, what to ask, what to say, how to be supportive. And so the symptoms, right? Knowing what is typical, this is hard, life is hard, versus this might be something to talk to your doctor about. And so looking for those indicators of, I'm not like myself, other people are worried about me. getting up to brush my teeth is hard. Doing very basic things is challenging. I'm not connecting with my baby. I'm not experiencing any joy. Life isn't easy. And it's more than just not being easy. I feel very disconnected.
Interesting. Now, what was astounding to us is that reports from both Missouri and the March of Dimes show that there are just some clear healthcare inequities when it comes to not just mental health, but just access in both our states. How do you address that and make this more equitable and especially in rural areas, help the people in need?
Interestingly enough, Missouri has lots of different pockets of populations. We have rural, we have suburban, we have micropolitan, urban. And so what's fascinating about what's changed in the last 5 years is it's not just access, it's when you do have access and you come in, are the providers caring for you actually following all the evidence-based guidelines for screening, for referral? We find that especially coming out of a pandemic, it's been hard because people might ask a question that they're not exactly sure how to treat. So let's say a patient comes with symptoms of psychosis. Is every clinician that's taking care of OB patients, are they comfortable with what the next step is? And we realized that at the state level, the Perinatal Quality Collaborative, which is a state group of practitioners and different people at different levels from all over the state, we realized that the actual clinicians don't even know exactly what to do. We're not screening and following the evidence-based guidelines. And then when a patient does come and ask for help, we're not exactly getting them to where they need.
What do you tell your patients?
I tell my patients, number one, anything that you have a problem with, I have a problem with. So if you have an issue, I need you to come and tell me so we can make sure that it's not an issue together. Number two, if there's anything that someone that's a clinician is telling you that you're not comfortable with, get a second opinion. We only want you to be comfortable with your care, and we only want you to feel that you trust the people that that are taking care of you. And number three, this doesn't have to be a horrible experience. It can be a wonderful, glorious time in your life, and we just want to partner with you. That's one thing we don't do very well is we don't have this cocooning effect, but we're getting better. And we realize that now. So there's lots of money and resources going just to that.
Right. And just keeping, as you said, these open lines of communication, that's so key. All
Yes.
right. Drs. Tiffany Ruffin, Tracy Johnson, thank you so much for getting to the heart of this important matter here in our two states. The state of Missouri is working on a resource dashboard for families online, but in the meantime, you can go to this website, postpartum.net. It has free online support groups and free educational materials for families too.